Dr. Diez, I want to talk a little more about denture and especially denser adhesive, the denture cream we put in to, I guess, glue that stuff to it or somehow glue it or whatever. And lately I have heard from a nerve specialist doctor that apparently there's a lots of controversy out there that some of that stuff, Fixodent and whatever, is having too much zinc in it, and it gets in the body and gets nerve damage, which can be shown by any nerve damage, by the way, can be shown by having tingling, numb fingers, legs, toes. Those things could be heavy nerve damage. If not fixed, nerve damage is like a root. It dies out and it can never be fixed. Now, a lot of it apparently is linked to it, but there's always a lot of garbage talk out there. What do you think about that? And if there is something to it, would you explain the hybrid denture, the one which has implants in it and sticks it to it, would that actually solve that problem, just in case it is such a thing?
Yeah. But you kind of took the words out of my mouth. Here's the way I look at it. There are links to those side effects with denture creams and adhesives. The part that I want to stress, and the part that I think is important, is 99% of patients who use these adhesives don't have to. There's a reason they're having to use adhesive. Either the denture needs to be relined, a new denture needs to be made, and there are some patients that have such a lack of support or jawbone to hold a denture that no matter how well the denture is made, it's not going to fit well. That's where implants come in. The artificial root or little metal rods or posts that they put down in the jawbone that the denture can snap into. So if you can't have a denture that, even if it's made right, is going to fit well, you always have the options of implants, which...
But when you say implants now, you're not talking a whole mouth implant, because the reason most people these days, if they have a denture, there's a financial reason for it, right?
Right, that is a solution, but that gets extremely expensive to replace every tooth with an implant. But you can use 2 to 4 implants, to hold a denture in, and hold it in very, very securely. Yes, it does add some cost, but it's a world of difference in the way the denture fits. The denture literally snaps in to these metal posts, and it does not move. It has to be snapped back out.
Mm-hmm. And no adhesive ever needed.
No. If you're using adhesive, something is wrong with the denture, or something is wrong with the jawbone. And by that I mean there's not enough jawbone there to hold the denture. In both cases, the problem can be fixed where adhesive does not have to be used. Really and truly, again, I say 99%, but really it's more like 100%. There's no reason someone should ever have to use denture adhesive.
Wow. So really, none of us needs to worry, and I don't think none of us does worry, and it will not happen that we put out Procter & Gamble out of business because one of their product becomes outdated. And for all purpose, so if that problem is there, it's just, that's it. Go from the beginning. Go with that, and that's it. You will never need it. End of discussion.
Right. Go to the source, the cause of the problem, and it can be fixed, and you won't need adhesive.
Right. Now, let's assume there's a patient out there who over the years has used adhesives on and off and whatever, because as you said, as more walking as it gets, as more it probably uses, based on what you just said. So, and let's just say he has a little bit of tingling and numb feeling in the legs and whatever, and a weakness of muscle, I guess, is another one of those symptoms. What should that person do? Should he come to you? Should he go to a physician, to a nerve doctor? What's the deal there?
Well,
to check out and say that, number one, there's no systemic, I guess is the word for it, systemic damage to the nerve, which is super bad, and then to make sure that nothing more is happening and stuff. Where should he go to?
I think that patient has to see both. I mean, he needs to be evaluated by a physician to make sure it's not another problem.
Right.
Okay?
Or if it is that problem, if the nerves are a little damaged, as long as they're not super bad damaged, usually good doctors can bring it back again.
Right. But at that point, okay, I would make sure that anything that could have possibly caused the nerve damage should be eliminated.
Well, of course.
Okay?
Yeah.
So at that point, they also need to see a qualified dentist so they can have a proper fitting denture and eliminate the possibility of the denture adhesive being the source of their nerve problem.
Correct. Well, all right. Again, wonderful. And it's quite amazing how, too much of anything is bad, because zinc is a good thing. We do need zinc. It's, there used to be a time, there's zinc supplements out there. But I think it plays very well with what you said with the periodontal diseases. It's the gateway to the mouth. The mouth is the gateway to the body. And, you have that zinc in there. It's just too much. It just soaks into the body like there's no tomorrow, probably better than supplements,
Right. Well, a good example is when someone's having a heart problem, where do they put the nitroglycerin? They put it underneath your tongue because it gets absorbed into your bloodstream like that.
Yeah, absolutely. So if you now constantly have, something so zinc-laden in there, then it does it. And so a person who does have nerve problems, number one, he should go to a physician, period, whether he takes denture adhesive or not. If he should go for any reason, there are many other reasons it could happen.
That's right.
But if he does take denture, should go there, should mention it to his physician that he does. Always should stop and should go to a dentist and then go and get probably that hybrid so that just doesn't have to happen anymore.
That's right.
Thank you very much, Dr. Diez.
Thank you, Helmut.